Hey everyone, let me ask you a question. Is your loved one taking an antipsychotic medication because they have dementia and they may have behavioral and psychological symptoms related to dementia? Well, if yes, this video is for you. My name is Dr. Eric. I'm from MedBetter Health, and I want to help caregivers really understand the essence. Now, what's important for you to know is obviously each of you listening there in the virtual world have your own doctors, so this advice is general advice. It's not directed as medical advice, and you should always speak to your own doctor before you actually make a decision. But we have certain things called behavioral and psychological symptoms of dementia. That's when your loved one can have agitation, aggression, paranoia, and other types of behavioral symptoms, right? And very often, the first thing that we tend to do is we tend to say, all right, let's give mom a medication. Let me call the doctor. Hey, doctor, let me go to the visit. She's acting agitated. And he says, you know what? Let's give her some medication to calm her down. Well, the first thing you have to understand is before you give someone a medication, you have to identify, is there anything else that I can do to avoid giving the medication? Why? Because as I always say, medications are not TikToks. Medications, what they actually have is side effects. So let's take a look over here. While medical triggers must be treated, turning to medication strictly for behavioral control can carry significant risk. Why? Let's take a look into the data. Antipsychotics used in older adults with dementia-related psychosis carry significant safety concerns, including mortality risk. There's actually a black box warning on a medication such as Seroquel. So I'll tell you a story about my grandmother, right? My grandma's 93 years old. My mom and dad, they're 70, and they take care of her as caregivers. And so my grandma, she started having these episodes of agitation and aggressions, and she had private duty home care there and home care in her home. So all of the aides, they were reporting to my mom and dad, like, look, we can't stay here anymore. This older lady, but she is so aggressive. So the first thing I always do is I try to see non-medication related interventions. What is causing my grandma to be aggressive? Is it the fact that the home health aide who's coming in, is she wearing scrubs? And are those scrubs triggering my grandma to think that she's in the hospital and making her nervous and making her aggressive to that individual? So instead of giving my grandmother Seroquel, I'm going to say, hey, Mrs. Smith, you're amazing, thank you. When you come, are you able to put on, let's say, just regular clothing so my mom doesn't think that she's in the hospital? Maybe that's triggering it. Maybe the lady who's coming in is coming in like this, right? And maybe they're upset. Maybe she thinks that someone is stealing from her because things keep on moving in her room, and that's why she thinks that things are being misplaced. So before you go to antipsychotics, right, medications require careful, ongoing clinician judgment. And what I want you to take away from this video is not that you should stop giving medications. My grandmother, I've excluded everything, and I still needed to give her a low dose, a very low dose, understanding the risks and the benefits. Not a high dose, but what's the first thing I did? And the first thing you should do is environmental optimization and emotional de-escalation must remain the primary tool. And obviously the first thing you should do if there's some kind of behavioral and psychological symptoms of dementia is talk to your doctor. Talk to your mom or your dad's doctor or your person living with dementia doctor. First, reach out to them. Describe the full story. And then ask them, Dr. Smith, is there a way that we can have non-medication related interventions first as opposed to medication related? And then look into, and by the way, I have a great video. If you click over here, it talks about the behavioral and psychological symptoms of dementia. Highly recommend you watch this video because what it's going to do is it's going to open up your eyes how you, the caregiver, can actually intervene with non-medications. But as always, speak to your doctor first. I hope you enjoyed this video. If you're a caregiver and you're like, wow, I wish I had this on a one-on-one basis, you could actually have it. And you could have it where actually you're not paying for it, but Medicare is paying for someone like me, for a care navigator, a dementia proficient provider, to talk to you one-on-one and guide you. If you're interested in learning about the program, the QR code is right over here. You can look above for the link and you can visit our website, or you can click on the link in the description to learn more about this incredible program. I'll see you on the next video.